Well, there's no question that violence impacts mental health, which in turn impacts health and general well-being. So today on the show, we'll be focusing on the impact of sexual gender-based violence on mental health and physical health. Welcome to the show. My name is Winnie Lubembe, but before we get into the discussion, take a look at this fact of the matter. Sexual and gender-based violence has devastating long-term consequences for mental and physical health, including injuries, unwanted pregnancies, sexually transmitted infections, and fatalities. Survivors may also commonly experience severe mental health issues such as depression, anxiety, post-traumatic stress disorder, sleep difficulties, and increased risk of substance abuse. All right, let's get to understand SGBV in its truest forms and also look at its impact on mental health. And this is sort of like a series that we're beginning. We'll start with mental health and then we'll look at physical health in a different episode. But for now, we have George Wambugu, who is a public health specialist as well as a medical manager right here at MSF. Good to see you. Good to have you on the show. How are you doing?
I'm doing well.
Thank you so much for hosting us today. Let's start with SGBV, understanding what it is and what that looks like.
Okay, sexual and gender-based violence has different forms. Okay. We have the physical violence. We also have what we call intimate partner violence, which can be physical or sexual or even emotional. Okay. We also have, I think I also said we have emotional violence or psychological violence. And also we have sexual violence. Right. But for MSF, we focus on sexual violence, even though we have a few survivors for physical violence.
All right. Yes. So then what exactly is it? When someone comes to you and says, I have been sexually sort of like abused or, you know, sexual gender-based violence, what exactly does that look like?
Basically, for sexual violence, maybe in a layman perspective is like what is called rape or defilement, even though there are different types, even sexual harassment. But for sexual violence that we deal with, we see survivors of rape and we provide medical care. Okay. That is prevention of unintended pregnancy in women of reproductive age, and also prevention of sexually transmitted infections, including HIV. And also we manage, in case there is a physical problem, like if there is tears or if there was history of instrumentation. And also we provide also mental health services. Yeah. And also for some survivors, they require also social services like protection, or they require linkage like to legal support or referral to other social services, including going to report the case in the police station or being supported to go to file the case in a court of law. Yeah. And also there is medical legal support or services. Things include filling of medical legal document, and also once they go to the police, they are normally given what we call a medical legal document called a P3 form, and then also even that one we fill, and also going to court. Okay. So going to court to give expert testimony. So our medical providers go to court to give a expert testimony.
Okay. What are the numbers saying, you know, based on the data that you have as MSF?
So for MSF, I'll talk of Nairobi Eastlands, where Medicine Sans Frontiers, our organization, that is Doctors Without Borders, where we are located in Eastlands. And we respond to urban violence, and sexual violence is one of the urban violence. Since 2008, after the post-election violence, we saw a number of sexual violence survivors coming to seek care. And through this, we did a small assessment in Mathare slums, and we saw there is unreported sexual violence. We opened a sexual violence clinic in Lavender House, which is called a Hope Clinic. In Swahili, it's called Tumaini Clinic. And up to 2015, when we received a lot of survivors, we saw there is a need of sustainability and also decentralization. So we supported Ministry of Health, that is Nairobi County Mama Lucy Hospital, to open a Tumaini Clinic, also in Makadara Health Center, and also in Kasarani Health Center. And later, the Makadara Clinic, it also transitioned to Mukuru Health Center, because we realized most survivors were coming from Mukuru slums. And then also Dadora 2 Health Center, we opened Tumaini Clinic. So for 2024, we saw 4,603 survivors of gender-based violence, of which 78% were sexual violence survivors. That is 3,600, more than 3,600.
And you see, most of the time when we talk about gender-based violence, the inclination is usually towards women, but also men, you know, get abused or experience violence. And now that we're talking about sexual gender-based violence, what then do the numbers say as far as the men are concerned? Or have you experienced men come to, you know, any of the centers that you mentioned?
Yes, so for men, like our 2024 data, 9% were males, including adult men. And also men are also sexually assaulted or violated, and they represent what we call the key population in sexual violence, because generally from public health perspective, men have poor health-seeking behavior, and we know like it's not easy for a man to go to seek care once they are sexually violated. And this is why also MSF, we have a team that does health promotion and also service promotion in the Nairobi Eastlands to create awareness.
Then how does it present itself? What is the manifestation that you would look at and say this person has been has experienced sexual gender-based violence?
Okay, mostly for our program, we have as I explained, we have medical, mental health, medical legal, and social. So for mental health, some of the survivors present with depression or suicidal thoughts, or they have aggressive behavior, or they are not interested to do whatever they were doing, or also some of them present with psychosis, and also others present with post-traumatic stress disorder. So that's how they present. From our data, 60% of our survivors are below 18 years of age, and also it includes 18%, that is maybe for the numbers is 636 survivors who are seen in 2024 were below the age of 10 years. And for children, it's very necessary that they are evaluated by a psychologist, because also we have what we call the unseen signs and symptoms, like, so that's why they need to be evaluated by a psychologist. And also in case we have a survivor who was gang raped, a survivor who was maybe has been raped, was raped like previously or was sexually violated, also they need to be evaluated by a psychologist. And our counselors also, they do psychological first aid. So maybe for the patient flow, once a survivor comes to our facility, it's the counselor who takes the history, does psychological first aid, trauma counseling, and also is also able to identify if someone has a psychological or a psychiatric emergency.
So what are some of these unseen or the silent signs and symptoms that maybe we should be aware about as a society, so that, say, if I notice my friend or my sister or my brother, you know, experiencing this, then we sort of like find a way to help them.
Okay, so what I would say for signs and symptoms of mental health, of course there is, like when we talk of like in the society, maybe people will see someone is now withdrawn, is unkempt, is like not interested, like they are absent at work, they are not doing whatever they were doing. Also, if they were social, maybe now they are not social, like they are withdrawn. And of course, there are different other manifestations that patients come with. I would not say like all patients present the same.
It's true. Yeah.
Every patient presents different. And also that is in medical. Now for SGBV, also for every survivor presents different.
Okay. I'm curious a little bit about the men. What are these sort of like either clinical manifestations or physical presentations that someone has been violated sexually?
So for clinical manifestation, of course, from the history, they will tell you like I was raped. And also from the history, you can be able, like the medical history, as a provider, they'll tell you like, they'll give you the history of what happened and when, how, and also from physical examination, because medically you also need to examine the patient or the survivor. So for the survivors, like male survivors, also once you examine, you may see like if there is anal tears, or that is if there was sodomized. You'll see like if there was anal tears, or if there is pain, or if sometimes also there is history of instrumentation, like if like a bottle or an instrument was like used to perpetuate the violence.
And George, can we talk about the emergencies a little bit before we talk about diagnosis, okay? What does that look like when we say someone has been sexually violated in sort of like an emergency situation? What does that look like?
So for sexual violence, because at your MSF, we deal with public health and also humanitarian emergencies. Yeah. And in our line of work, we also find women who are, and also men, and also children who are sexually violated. And for us, we have adapted our response to emergencies to include providing care to survivors of sexual violence. And also in Eastlands, because emergency can also mean medical emergency when it is one patient or survivor. So in Eastlands, we have a pre-hospital ambulance activity, and we have a criteria in case we have a survivor who has a medical emergency. We normally respond and go pick them and help them access care as soon as possible. So when we talk about emergency for a survivor of sexual violence, it can be a survivor of sexual violence who is not accessing care within 72 hours. Okay. Because why is it necessary for a survivor to access care within 72 hours? Is because we normally give what we call post-exposure prophylaxis to prevent HIV infection, and they are supposed to be given within 72 hours. So like example, if a survivor calls our call center and it's maybe at 71, we see like the only 1 hour or a few minutes remaining, we dispatch an ambulance. Okay. Another emergency, medical emergency affecting one survivor would be when a survivor, let's say someone is unconscious, the caller calls, is unconscious, or is actively bleeding, or gives us a history of instrumentation, we normally dispatch an ambulance to go pick the survivor, so that they are able to access care. Yes.
Does it mean every survivor who's gone through SGBV, will they automatically end up with a mental health disorder or condition?
Yeah, for all survivors of sexual violence, not all of them will develop mental health challenges.
Okay.
And that's why it is essential that at first they're provided psychological first aid, trauma counseling, and then also, like, in case they are like under 10 or under 12, they're able to see a psychologist early, so that any signs and symptoms can be detected early. And also that's why it's also essential, like, for those who have been gang raped or have been raped again, they are able to access a psychologist.
Do you have tools to then ascertain what this is based on the presentation that, say, a survivor comes with?
For us, as I explained, we focus more on sexual violence, but also we have survivors like of physical, or both of them, both versions, and even by an intimate partner, in what we call the intimate partner violence. So for the tools, you know, like when I say tools, is what I mean is every medical profession, including psychologists, they normally have what they used to screen and also to collect history. And also we also observe how the patient presents. You also do physical examination, and the medical history, like what the patient will tell you or what the survivor will tell you, versus also the physical examination, and how a patient presents is what is going to guide you to make an informed diagnosis.
A patient might present with, say, depression, probably develop, anxiety or PTSD at some point. So then what does treatment look like for a survivor of SGBV?
Okay, there are those survivors who require counseling, and then also they are followed up for 3 months. They are followed after 1 week, another monthly. They are also followed up, but it also depends with how a survivor presents. Then there are those who require psychotherapy, which is provided by a psychologist, including psychological emergencies. And then there are those that require inpatient care, because maybe like suicidal ideation, they normally require like to be admitted in a mental health or a hospital that has a psychologist, so that they can be provided care, that is psychotherapy, and also they'll be followed up based on their presentation, and also based on the psychologist, how they see the patient. And also there are those who require psychiatric care. So those, like now, those that needs to be put on maybe drugs, that is medication. We refer them to a psychologist.
Okay. Yes. So can we talk about the impact of not seeking help at all, and how bad it can get for survivors of SGBV?
Of course, if they don't seek care early enough, especially within 72 hours, and they're HIV negative, chances of them contracting HIV, which can also impact on their mental health. And also, if they develop STI, it also can lead to mental health problem. Also, if they are not able, or they have an intended pregnancy, which could have been prevented by accessing an emergency contraceptive. And also, if they don't have access like to trauma counseling, they can present with a more severe form of, let's say, like depression, or they can even commit suicide, or even commit suicide, and also they can harm themselves.
Okay.
Yes.
Ideally, how long is the course of treatment before either they're being reintegrated back to the society or probably allowed to go to safe houses?
What I would say is for treatment, it's patient-centered. But usually, like a patient should, for post-exposure prophylaxis, it's normally given for 28 days.
Okay.
And for STI, it's just a 1 day treatment. And also there is hepatitis B, a vaccination that is provided, and a patient is supposed to be followed. Usually we use the rapid hepatitis B vaccination schedule recommended by WHO, like 07-21 days. But our survivors, we follow them up to 3 months. But that is the standard.
Okay.
But if there is a needs-based, like even to follow them afterwards, we still follow them. Yeah.
Okay. There's this thing where they say like healing is a journey, and especially for someone who's been through SGBV. So even when it comes to like counseling therapy, maybe seeing a psychiatrist, is this also within the 3-month period, or do you continue to follow them even after the 3 months?
Yes, as I said, it's needs-based. If a survivor needs more than 3 months, we'll still follow them up. Yeah, because we provide patient-centered care.
Okay.
It is centered towards the treatment plan is designed based on the way the patients present and what they need.
Okay.
Yes.
All right. Cases of, say, reintegration or safe houses, what is that process like? What assessment then do you use to say, okay, this one is probably okay or mentally strong, either to go back home or say go back to society, or even, seek help from like safe houses? So
the same as I said, we have now medical, mental health, then social. We have a social worker. We also have a social work guideline, which determines like the way patient presents based on the history. Like if someone needs protection, e.g. if a child was sexually violated within the family or by a neighbor, the neighborhood, and they needs to be protected, or if like a mother is assaulted by the husband and needs to be protected, we normally have a temporary shelter, and then in MSF Lavender House, and then we normally link the patient with the shelter, with different shelters, because we normally have a shelter networking in Nairobi County. Different providers provide shelter services, but it is patient-centered or survivor-centered. If a survivor wants to go to, let's say, back to the ancestral home, we normally support them with transport to go to the ancestral home, or if they want to be reintegrated back with their family, we also support them with that. So then, as we bring this to a close, from where you sit, what more support would you say SGBV survivors either should get or should be strengthened to help, and also the possibility of completely preventing cases of SGBV? What would you say? This is your camera. For me, what I would say is, as a medical organization, of course, we would want like survivors to access care timely, at no cost. The Ministry of Health has developed guidelines that survivors of sexual violence should not pay any money, even if they are not registered like for SHA. They should be able to access care within 72 hours. And also we should create more awareness in the community so as to prevent, and also to create knowledge on what to do and not what to do, and also where to access the service. Okay. Yes.
All right. Thanks, George. That was George Wambugu, who is a public health specialist as well as a medical manager right here at MSF. Well, time now for you to take a look at this health tip.
On today's